Hello, and welcome to the March 2026 edition of From the Desk of. I'm Bethany Samuelson Bannow, and I'm privileged to serve as the editor-in-chief of your favorite source for clinical news on the issues that most affect you and your patients as a hematologist, ASH Clinical News. March is often a month of change as those of us in the Northern Hemisphere experience the spring equinox and hopefully wrap up the 6 more weeks of winter predicted by everyone's favorite Pennsylvanian rodent this year. Changes in the air, and as always, ASH Clinical News is here to keep you up to date on the most important changes you can expect in the world of hematology. The issue kicks off with an editor's corner from our AP editor, Jen Lauder, PhD. Jen explores the topic of clinical uncertainty in medicine, its role in clinical decision making and the patient-clinician relationship, as well as the decreasing tolerance for it in the age of AI and instant answers. Importantly, she reminds us of the central role of human judgment and personal interaction in healthcare that AI can never replicate. Next, Doctors Samar Al-Hadidi and Raj Sheshkar Chakraborty offer a letter to the editor on the overlooked burden of cytopenias with BCMA-directed bispecific antibodies, raising some important questions and opportunities for discussion. This month, our You Make the Call case focuses on a complex case of multiple myeloma in a patient with secondary myelofibrosis and ongoing anemia, as well as the fourth installment of our wellness column by Drs. Urvi Shah and Christina Gavin, which addresses the importance and safety of exercise in even our most vulnerable hematology patients. Our feature this month is the third in our series of the role and impact of AI and our practice as hematologists. This month's focus is on the role of AI in medical education, revealing how hematology faculty and trainees are adopting artificial intelligence to enhance learning, while walking a careful line to preserve and strengthen skills in critical thinking. Arguably, the most important thing our trainees can learn in a day of instant, but not always accurate information. The importance of critical thinking is further highlighted in the first article in our In a Different Vein section this edition, where the authors question if it's time to revise myeloma diagnostic criteria based on a decade of serum-free light chain ratio data. Other exciting new publications from ASH's Blood Journal series highlighted in this section include an update and consensus from the Alinda Vid MRD Working Party on MRD and AML, a research article on a new stem and progenitor cell derived gene expression signature proving prognostic of survival in myelofibrosis, and outcomes of MRD-driven initial therapy of acalabrutinib and lenalidomide plus rituximab or obinutuzumab for mantle cell lymphoma. In Literature Scan, we highlight 4 papers from NEJM, Lancet, JCO, and Pediatric Hematology Oncology, as well as bonus online-only coverage of the Lancet publication on the EPCOR-FL1 follicular lymphoma study. This month, we offer you not one, but 2 perspective pieces on these important articles, including one by Dr. Lydia Pecker on trends in hydroxyurea utilization and cerebrovascular outcomes before and after publication of the 2014 NHLBI sickle cell disease guidelines, and one by Dr. Manisha Bhutani on dual targeting of extramedullary myeloma with talquetamab and teclistamab. The other 2 papers include primary results from the phase 3 CANOVA study of venetoclax dexamethasone versus pomalidomide dexamethasone in translocation 1114 positive relapsed refractory multiple myeloma, and the phase 3 inMIND study of tafasitamab and lenalidomide and rituximab in relapsed or refractory follicular lymphoma. In ASH Directions, you will be inspired by Dr. Ronak Mistri's story as he shares his experience as first an MEI participant and now an instructor, and his commentary on how it has impacted his path as a medical educator. Thanks again for weathering the season of change and joining us at ACN this month. I'm Bethany Samuelson Bannow, encouraging you, as always, to stay curious, stay informed, and stay inspired.